Hey everyone, it's your girl, Dr. Letitia, and welcome back to my web show, Coffee and Conversations. As always, I have an interesting guest for you, so please join me in welcoming Dr. Quincy Bloxom. Dr. Quincy Bloxom, MSW, DSW, is founder and director of Erase The Redline, Inc. and owner of Erase The Divide LLC. He recently served as Tri-Chair of New Jersey's Poor People Campaign, a national call for moral revival, and is currently pursuing a certification in financial social work. He is also the immediate past president of the Board of Directors of the Anti-Poverty Network of New Jersey and sits on the board of Addiction and Behavioral Alliance, LLC. He recently completed a Doctoral of Social Work degree from the University of Southern California, taught as an Adjunct Professor at Seton Hall University, and continuing education instructor with Rutgers University. He's also a Governor Murphy appointee to the Reverend Dr. MLK Commemorative Commission. Prior to becoming a social worker, Dr. Bloxom served in the U.S. Army, achieved the rank of Staff Sergeant, with multiple awards and decorations associated with his service and deployment under Operation Iraqi Freedom. His current place-based research and practice centers around harnessing technology for social good through increasing internet connectivity and unlocking government data as prescribed by the American Academy of Social Work and Social Welfare Grand Challenges for Social Work. At the macro level, he has served as an advisor to dozens of advocacy groups presenting around his forthcoming text, Erase the Redline, a comparative study and comprehensive community guide to combat the effects of redlining in New Jersey. In addition to consulting community-based organization, Dr. Bloxom previously served as Director of Operations and Development to a holistic wellness, substance abuse, and mental health outpatient treatment facility. Thank you so much for all of your amazing work, and please join me in welcoming Dr. Quincy Bloxom. Hello, hello, hello.
Hey, what's going on?
Thank you so much for joining me. I am so glad to see you. It's so good to see you. This is the first time being face-to-face since the pandemic.
Absolutely.
Tell me about, well, first of all, I think we should let my listeners know how we know each other. Talk about how we met, please, Dr. Quincy B.
Oh, I didn't know we were going to have to take it back this far.
Oh yeah, we're taking it all the way back. We got time for that. We're taking it back.
So my initial meeting with you was when you were, I think at that time you were the director of the addictions program at Rutgers. I was finishing up my certification for addiction and drug counseling, and we had to do this summer school of addictions thing, and you were one of the keynote speakers at the summer school of addictions thing. The funny story about that is, but the audience doesn't know that, like, I started off as a researcher, got offered the opportunity to do the substance abuse counseling training through Rutgers. So I said, yeah, why not take it up, get a certification. And then I really started taking counseling serious, but didn't really see many of us in the field, especially at those top levels. So seeing you being that keynote speaker on that particular day when I was still a little hesitant and going back and forth about where my education was going at that time, I'm like, this is dope. So like it really had a large influence. And this was back in 2013, 2014, maybe. I think the summer of 2014, if I'm not mistaken. So yeah, known each other for a while.
It's been a while. And to watch you grow, right? So to watch you go from that to the MSW to now the DSW, talk to me a little bit about that journey, what that has been like for you.
It's been difficult, right? But also really, really eye-opening. Just to start off, being in the programs that I was in, I started off with pursuing a business degree. Then I started falling in love with the social sciences. So I started taking more social science classes. Then I realized, like, okay, depending on what I major in, like what I declare as my major, I can have a double major. So I ended up with a liberal studies focus with a dual concentration in business and social sciences for the bachelor's. But going back to the research, doing independent research on urban education and addictions, getting involved with some professors at Rutgers Camden. They're like, if you're really interested in doing this research, then you should actually pursue like research as a as like your job, right? As a profession. And I'm like, I don't know, but we can try it out. So even before I graduated with my bachelor's degree, I was actually offered special permission to enter the PhD program in public affairs and community development at Rutgers Camden, which was kind of unheard of. So even talking to other professors, when I was finishing up my bachelor's degree and I was telling them the other types of classes that I was taking, and they're like you get that side eye, like what are you talking about right now? So it's been really interesting, and then kind of finding my way through that, learning from you and other mentors, like while I was doing those PhD courses, that I can do the same thing at the macro level through the MSW than I was doing, kind of pursuing that PhD. Not believing you all at first, and then looking into what social work was and what social work could be, or what social work was before the profession kind of split. I'm like, oh, I can really do this. So I finished up that bachelor's. I left that PhD program, did the 2-year MSW program in Rutgers Camden, back and forth online with Rutgers New Brunswick. And I like to say the rest is history, but it's just been it's been occurring so fast. It's just like it's a lot of things going on, a lot of different spaces, right?
I think add to that, getting the DSW. You said something earlier, Q, that I definitely have to come back to. And you said there are not many people that look like us. There are not many people that look like us at the master's level, but the higher you go, there's even less people that look like us. What encouraged you to get the doctorate in social work?
I think for me, it was kind of not knowing what I knew at that point in time, and really feeling like I had to kind of learn more in order to take my research, in order to take my advocacy to that next level. Okay. Because I was already in a bunch of rooms, right? Already consulting a lot of PhDs, already consulting universities, even with my MSW, doing continual education training as an instructor without a license. So using my community acumen and my leadership experience from being, having some okay rank while in the military, I wanted to step my game up and learn some different methods, and incorporate some of the other methods that I was learning from research back in the day, and all that community activism, and being a radical community organizer, and saying seeing why I wasn't seeing more of that in social work. And it was a change management and innovation focus for the DSW program too. So for me, I wanted to do something that was practical. I wanted to do something that was practice oriented, but I wanted to do something that would allow me to pivot when I felt the need to pivot. I'm not, and this is an unpopular statement, right? But I'm not loyal to any particular discipline, right? If I see a problem in the community, if I see a problem at the state level or the national level, I'm going to go and research the entire problem landscape. Because the larger the problem landscape that you're actually experiencing and researching, the larger your solution landscape is. So I didn't want to be boxed into one particular area or discipline. And I thought, like, doing the DSW, because it's a practice driven degree program, that I'd be able to look at all those different programs, from public health, right, to public admin, to public policy, and I could actually find my niche, or more clearly explain my niche to individuals in the helping professions across the board.
And first of all, thank you for your service. All right. That's so important for me to say that to you. But I want to go back because I want to talk now about Erase the Divide. I also want to talk about Erase the Redline. You are the founder of Erase the Redline and the owner of Erase the Divide. And you talked about going back to the history of problems. And so I know the history of both, but I want my listeners to know the history of both, because so many people are just not educated, Q, about what redlining is, or how the digital divide in 2021 impacts communities of color. So if you can talk to us about both of those, I think that would be super.
Okay. So I start off by saying that because we kind of forgotten our history, or we have, kind of a historical amnesia in academia, sometimes it gets a little murky to point some of these things out and really
It's
clear.
selective. Let's just say it's selective. There's like a selective forgetting of the history. I just want to say that. That's
Right. What is that? Convenient amnesia?
Convenient amnesia, yeah.
So the short of the long, redlining is kind of defined loosely as the systemic, structural, and intentional divestment in communities of color, supported and sanctioned by the federal government, USA, right? So the term redlining itself came from the discovery of Home Owners Loan Corporation maps, which was the governing body that told the Chicago Realtors Association how to actually distribute mortgages in the time period between like 1930 and so on. So the term itself, redlining, comes from there being four different degrees or four different colors on a map. The red area on the map was the lower desirable areas, high risk areas, mostly populated by people of color, black individuals, and laborers. And that area on the map was red. Then you had the other four, and I always start with red, which was the lowest level. And then there was A area on the maps, which was green. There was a blue area on the map, which was B, and there was a C level on the map, which was yellow. All with varying degrees of whether or not mortgage providers or mortgage companies could actually provide investments, loans, and resources to those particular areas. So that's redlining. Fast forward now, when we're talking about structural racism, when we're talking about all the social determinants of health, and disparities that exist within the social determinants of health, I use redlining and the analysis and the data from the redlining maps because there's direct overlays between what was occurring in the 30s. By the way, we didn't discover those redlining maps until the 1960s, which means that those things were occurring for 30 years before most people even knew it was occurring and could prove it. And then there came the 1977. Now I'm drawing a blank. The 1977 CRA, which is the Community Reinvestment Act. So there's a lot that was built upon that structural racism and that redlining and that
for decades
disinvestment for decades. So now coming up on a century, right? Which was really why I wanted to start doing more work around it, to say, okay, when we say that certain things exist in certain areas because of what people are doing or the lack of an individual's will and schools not having enough resources, like there's a reason for all of those things, and it's all linked to poverty, like not poverty, policy. And we talk about social determinants of health all the time, or sometimes, depending on what rooms you're in, but nobody really wants to call out political determinants of health, right? Because for every social determinant of health, income, educational attainment, your physical built environment, your legal status or your interaction there, and your health and wellness, for each one of those and all the variables that exist within those, there's a policy somewhere that made it so. So we can't really look at those social determinants without actually looking at the political determinants. So all that is redlining. Digital redlining can be defined in different ways. So Erase the Divide as a for-profit entity is actually more about the information divide, and then linking that to the lack of digital access that exists throughout this nation, right? Somewhere upwards of 35 million people throughout the nation not having adequate access to internet services and devices and the ability to effectively use those devices, right? So
Dr. Q, run that stat back one more time, right? Because I know my listeners are not going to believe that in 2021, 35 million people do not have access to the internet, do not have devices that can get them to the internet. I think that is significant. That is about what, 10% of the US population.
Right.
So please run that back one more time.
So yeah, 30 to 35 million individuals. And that information is coming from the American Community Survey data that is done by the US Census Bureau. However, there's also a caveat with that number that stick a pin in that and remind me to actually talk about like what we're trying to change with the way we define things with the American Community Survey data, or the ACS. But the way we ask questions on that survey through the US Census Bureau actually says, do you have access to technology? Do you have access to the internet? So that 30 to 35 million number is a mix of individuals who either have devices but don't have the internet, or have the availability of internet but don't necessarily have access to the internet and can't really adopt or use the internet. But the way the question is asked through that survey is, do you have access to it? Not do you own it? Not do you have it in your home? Not is it yours? And to get a little nerdy, right? The American Community Survey it's a survey throughout the nation. We survey about 1% of the population every year to add up to this estimate of who does and doesn't have certain things. So there's a bunch of different methodologies that goes with that. There's also a non-response bias at certain times. There's also like, you're not available for a survey, or most of them are being done online right now. So technically through the rules, right? If you get called up for a survey, just like in the census, and no one's home and we visited you multiple times, technically we can go to your neighbor and ask them questions about you, and that gets documented. So yeah, there's a bunch of different ways you have to look at a bunch of different things. And then there's so many different tiers of access, because just because the internet is available within your jurisdiction doesn't mean that you have it, right? And just because you have the ability to access it doesn't mean that you have it, right? And just because you have it doesn't mean that you've officially adopted it and you use it in your activities. So yeah, in this super tech world, this 21st century, and everything's getting thrown online, we're talking telehealth, we're talking about emergency authorizations, we're talking Amber Alerts, we're talking everything being online right now. And our quick fix for everything is to say, okay, we can't access our clients, so let's do telehealth, let's do telemedicine, let's put everything online, without actually realizing that some of the people who may be the most vulnerable, the individuals who are likely the most vulnerable, aren't even connected to us in our reference network, right? So there's a bunch of different things around that, and that's actually what my dissertation / capstone was on, to not only free up resources at the federal level and assist the feds with seeing how this funding can actually trickle down into concentrated areas of poverty at the census tract level, but also, helping professionals accountable for what is and what is not offered at their agencies. And it was also really interesting in that research to see why some people lack access, or even the information to know that people around them are lacking access, right? So just looking at the finances of it all, looking at a typical entry-level social worker and realizing like, oh, their income level and their reference network, or the people that are surrounding them, are in that same cohort of that vulnerable population of individuals that they're serving. Right. There's all types of guilt and shame associated with that. There's just a bunch of things that you have to kind of tease out and be really careful about to be able to highlight all these things. So I know that's a lot, right? But it's what I do, right? So when people ask like, what are you doing right now? And I'm like, well, it could be anywhere from providing battery backups to unhoused populations for their cell phones, to working with national organizing groups on actually being able to more adequately and accurately measure the work that they're doing, to forming a youth policy coalition at the state level, right? So it just depends on that particular day.
How can on that particular hour for you? Because literally,
Right.
literally, it is one thing per hour. Tell me, as we get ready to close, what motivated you from a young man growing up in Trenton to want to make changes in the community? What do you think you would attribute that to?
I did it for selfish reasons. Like I couldn't, like, really, I was asking questions of people who I thought should know the answers, and they didn't have the answers. I was realizing that my network was getting a lot larger, from my military cohort, right, to my educational cohort, to my professional cohort, and bouncing back and forth between all these different disciplines and all these different reference networks, and nobody really had answers to the questions that I was searching for. Like, why can't I find a therapist that looks like me? Like, who's messing up on that level, right? Is that the state's fault for not having
the ball?
Right. Is that the state's fault for not having enough resources available? Is it academia's fault for not doing a good enough job with recruiting and retention? Is it, like, who's really accountable for these things, right? And if I have all these resources in this network and I can't find someone who looks like me, who I can trust, then what about the individuals that don't have that, don't have all those resources and that really large network? So I said, well, I'll do the research and I'll figure it out myself, and then I'll just start calling people out on it. So it was selfish. It was selfish because I wanted the answers, but then as I started digging more and more for answers, I realized that, like, either the answers weren't out there, or they were hidden, or they were so or the answers to those questions were, like, so ambiguous I couldn't put my hands on it. I just knew that wasn't right. It wouldn't work for the general population. So I said, okay, like, how can I do more to make sure these resources are getting down to the community level? And that kind of just took me throughout my whole research career and my whole professional career. And I'm still figuring things out day by day as I'm learning more, right? There's so much. I got like 15 books on my reading list right now, and numerous articles. So it was really about how can I see more access come into these communities that we need, because everything is linked, and we pathologize a lot of things that are purely results of what isn't available in communities, and we have to just start being more unapologetic with speaking out about those things.
In conclusion, what do you want people to know? What do you want people to walk away knowing?
I want people, and I didn't even mention this because we're still trying to get things cleared up, to push out this information in the clearest way possible. What I want people to know is, right now, there's probably somebody in your network without adequate access to resources and technology. What I want to say is that if your median household income is lower than $90,000 a year, within a month, there's going to be subsidies that flow from the federal government down through the state. And it's going to be able to give you a voucher for $50 off of your internet service.
Wow, that's huge.
And a voucher of up to $100 to acquire a device from connected entities.
Wow.
It's a temporary subsidy of $3.6 billion coming down from the FCC. Just had a webinar with them last week.
Wow.
The issue is that one of the issues is that we're not invested enough in our communities to see actually what our communities need, and not just us. And also, we're not looking at increasing our market share as our like agency owners. Listen, there's people coming to your agencies, and there's people that's not coming to your agencies that you can possibly help. We need to start looking at things in a really innovative way and saying, if I'm providing mental health and substance use services, what if I was also providing technology? Like, what if I was literally providing a device to those individuals who are coming into my office to do telehealth and helping them get connected to more things? we have to be innovative if we want to start building up our communities, right? Because the more innovative things you do at your agency, at your facility, it's going to increase your market share, and you're going to be doing something that's above and beyond what the next person is doing.
Absolutely.
So if you're not willing to do it for the right reason, then at least do it so you can actually get some more capacity in your agency to do more and to hire more of us. But that's another conversation for another day.
Oh, yes, a conversation. We definitely have to bring you back for part 2 and probably 3 and 4 and 5, because there's so much. There's so much. I just want to thank you so much for your time. Thank you. Please tell us how we can get in touch with you. Where can people find you?
They can go on Great Joy's page and just get linked to me, so you can filter out all. No, I'm just kidding. So Quincy B at EraseTheRedline.org is my direct email for Erase the Redline, which is the nonprofit arm. The consulting firm is Quincy B at EraseTheDivide.com. And you can reach me there. We can figure things out and look through some things. And I'll be sending information through you as well, Dr. Tish. So it won't be hard to get in touch with me.
Thank you so much. And we will have you back for part 2.
Thank you for having me.
You're welcome. Take care.